Polyarthritis can feel overwhelming. Multiple joints, multiple possibilities. However, it is easy to sort it out into one of these three buckets. Bucket 1, inflammatory. Bucket 2, non-inflammatory or degenerative. And bucket 3, systemic or metabolic illnesses or mimics. So let's see how we can sort out easily arthritis into these three buckets. Let's look at the bucket 1, inflammatory arthritis, characterized by night pain, effusions, morning stiffness of more than 1 hour, and the characteristic sign is activity improves the pain. Now look at the pattern in this bucket. If it is symmetrical small joint, it is RA. If it is additive, it could be RA. If it is migratory, think of rheumatic fever. If it is large joint with back pain, think of spondyloarthropathy. Never forget to look at the scalp, behind the ear and around the umbilicus to look for psoriatic lesions. In all cases, do a CBCSR and a C-reactive protein. Depending on the diagnostic question, if it is rheumatic fever, you can do a rheumatoid factor and an ACCP. If it is a spondyloarthropathy, you can think of HLA-B27. Otherwise, you can think of an ANA investigation. But the characteristic hallmark, early morning stiffness of prolonged duration and activity improves pain. Now coming to the second bucket. Here it's contradictory to the first bucket. The early morning stiffness is minimal and brief. Effusions are minimal. Usually activity brings in pain and rest relieves pain. So the patient prefers to take rest. Characteristically weight-bearing joints in Indians, the knee and the hip are the characteristic. Occasionally there are characteristic patterns like the Heberden's node and the Bouchard nodes in the hand. Usually inflammatory markers are not elevated in this. And systemic illness markers of inflammatory arthritis are absent. Radiologically, you can show bone loss and degeneration. The third is the metabolic and systemic illness or mimics. Here the characteristic point is that there will be a lot of noise and the systemic features usually outshadow the arthralgia and the arthritis. So there will be fever, maybe weight loss, maybe cytopenias, maybe renal involvement, proteinuria, maybe neuropathy. So these are all the clues as to when we should think of a systemic illness. When it's brief and a few days duration along with fever, think of viral arthritis. It could be associated with hepatitis B. It could be there in thyroid endocrinopathies and calcium metabolism disorders. So always keep it in mind that systemic signs and symptoms outshadow the arthralgia in these patients. So the quick take-home message, early morning stiffness, pain improves with activity, it is inflammatory unless proved otherwise. Pain decreased at rest brings out activity and little or no early morning stiffness, it is degenerative. When systemic symptoms and signs outshadow the arthralgia arthritis, think of systemic illnesses and mimics.